Ladies and gentlemen, welcome to MedSynapse podcast series. I'm your host, Dr. Nigar, and in this episode, we're joined by the experienced dietitian, Muskan Barmare. With a rich background in nutrition and dietetics from SNDT Women's University, Muskan brings a wealth of expertise to our discussion today. Her dedication to promoting holistic health, mindfulness, and client centered care shines through as we explore the intricate relationship between sugar consumption and overall well being. Get ready to gain valuable insights from Muskan's extensive experience in the health, wellness, and fitness industry. Today, we will be delving into the impact of sugar on the body and exploring alternative sweetener options. Welcome, Muskan.
Hello, hi. Thank you so much for having me here.
Thank you so much for joining our platform, Dietitian Muskan. It's our pleasure to have you here with us today on this very important topic.
Yeah. This is a very crucial topic and very vast topic. I am not sure if we would be able to cover everything, but I will try my best to do so.
Thank you so much. Now, we would like to begin with how does excessive sugar consumption affect various bodily systems and what are the long-term health consequences?
Okay, so first we're going to talk about excessive sugar consumption. It does have many significant impacts on different body parts, and whereas the long-term health consequences come into picture, we can talk about it later after I explain the impact on the body. So when you consume too much added sugar, it can affect your body in several ways. It can affect your heart, your liver, your skin, your pancreas, your brain, your kidneys. The most vast topic, which everyone really loves to talk about, your weight, your joint pain, even as far as it can go to sexual health as well. So I can explain each and every body part in detail or just in like a glimpse. So, excessive sugar for your heart can raise your blood pressure, increase any inflammation, even contribute to weight gain. So, excessive sugar is linked to many heart diseases, heart attacks, and strokes. Where it comes to your liver, the liver, the function of the liver is to metabolize sugar, which is similar to alcohol metabolism as well, which is converting into fat. So when you consume excessive amount of sugar, your liver converts it into fat, which can lead to fatty liver disease, which is again a risk factor for chronic diseases like diabetes and heart disease. Thirdly, your skin. When you consume excessive sugar, so sugars have various proteins attached in the bloodstream, which causes harmful molecules that accelerate skin aging, leading wrinkles. Then you have acne, saggy skin, all of that. So again, this a lot of sugar contributes to such things which happens in your body. Then we come on to, let's say, we come on to pancreas. So overconsumption of sugar can lead to insulin resistance, that is type 2 diabetes in general, where your body stops responding to a hormone called insulin properly. So insulin is a very important hormone which regulates the sugar levels in our body. Then kidneys. High levels of sugar can damage the kidneys as well, affecting the ability to filter the blood and leading the kidney to damage itself, or it can even lead to kidney failure, especially in individuals who already have diabetes. Then, as I said, the huge topic which everyone is very much concerned about is your weight. The sugar is directly correlated or co-linked with weight gain, is linked to weight gain as it inflames the fat cells in your body, which leads to increased weight, which in turn can contribute to obesity and other health issues. Then again, sugar can really contribute to your joint pain very much ahead in life. If you're consuming sugars in your 20s and 30s, you may have joint pain in your mid 30s. That's a very, very early age to begin with. So, excessive sugar intake can worsen joint pain, inflammation, and can lead to RA, that is rheumatoid arthritis. Then we have the brain. Sugar. Okay, so it's very simple. A lot of sugar can shrink your brain's capacity to store memory, to store information. The less sugar you consume, the more healthy your brain is, and the more capacity of your brain to store and grasp information is more. The more sugar you consume, the lesser the brain capacity becomes to, store memory information. You will store the memory information, and whereas we talk about the long-term health consequences of excessive sugar consumption, again, it can lead to heart disease, type 2 diabetes, obesity, all of the above, which I just spoke about. Even some type of cancers it can lead to if it leads to another level. So it is very, very important and crucial to be mindful of using added sugars in your diet, as they can have far reaching effects on your overall health and well-being.
Thank you so much for that step by step approach on how excessive sugar consumption affects our bodies. It is truly an eye opening to understand the long term health consequences associated with it. Now, let's go deeper into the differences between natural sugars found in fruits versus the added sugars in processed foods, and how do they impact the body differently?
Okay, so this is a topic where everyone talks about, should we have fruits, or is fruits equivalent to the processed sugars we are consuming. So especially we talk about honey and jaggery in this area a lot as well. So I'd like to cover that here as well. So when we talk about sugars, there are two main types of sugars. There are natural sugars, and then there are added sugars. Natural sugars, which are found in fruits, honey and jaggery, whereas added sugars are sugars which are found in processed foods. So how do they differ, and what effect they have on our body? So first, let's talk about natural sugars, which are found in fruits. So natural sugars are the sugars that are naturally in foods like fruits, dairy, and some carbohydrates. The impact of that on your body is good. These sugars are good for you because they come with essential nutrients like vitamins, fibers, antioxidants. These sugars are digested slowly, which helps keep the blood sugar level stable for a very long period of time. Whereas added sugars, which are found in processed foods majorly, sugars that are put into foods during the processing, like sugary cereals, we have candies, we have dessert, we have sweetened drinks, we have n number of things today in the market, which mostly every processed food or everything which you get in a supermarket has some amount of added sugars in them. So the impact of this in your body is quite a lot. So added sugars can be harmful when consumed in large amounts. Of course, anything more than moderation, if you're consuming, does become harmful to the body. It can not only be sugars, but it can be other things as well, like water, fat, everything. But here we are talking about sugar, so let's stick to that. So when you consume a lot of added sugars in your diet, they are processed. They quickly spike your blood sugar levels in your body. Then these sugars make you feel hungry all the time. They also contribute to weight gain as well. So when you have a lot of processed foods in your diet, you will often experience hunger. You will often experience you are gaining a lot of weight, even if you consume less food in the day. because it's the impact of the added sugars in the processed foods. So the natural sugars from fruits, honey, jaggery provide nutrients as well and energy as well steadily over time, keeping you full and energized. Whereas added sugars they don't provide any other nutrients, they just provide energy spikes and crashes, which leads to cravings, weight gain, and other potential health issues like again diabetes and heart disease. So this is very important for me to say, because when people say that we aren't consuming uh, processed sugars, we are eating honey or jaggery, again, yes, they are natural sweeteners. Yes, you can consume them, but again, in moderation, because anything in moderation is good for your body. Anything out of that, anything more is harmful to your body in any which ways. So honey and jaggery have natural sugars like fructose and glucose. They have many beneficial nutrients and antioxidants as well. So, however, they are still high in sugar. So, it's very, very important that they should be consumed in moderation.
Definitely, it is very crucial to recognize the impact of added sugars in the processed foods, as they often contribute to empty calories without providing any nutritional benefits. And
Exactly.
yes. And I believe that understanding this connection is the key to making informed choices about our diet and our overall health.
That's true. That's very much true. Empty calories are the worst. Empty calories, which are in alcohol and sweetened drinks. Uh, they are called empty calories for a reason. Why? Because they don't provide us with any other nutrients rather than just energy. That is the sugar which is providing us energy. So that's why they are empty calories. They are just providing us calories and not any other nutrients. That's why that should be very less in your diet and very much in moderation. If it's occasional, it's much better.
Exactly. And they not only contribute to weight gain over time, but also will lead to metabolic issues by time as well, which we may not see it directly, but it's a long-term process.
It is, it is. So as we say, sugar is a slow poison. It doesn't affect your body immediately, but you are consuming sugar like mostly every day. It may be in processed foods or even in your carbs, rice, roti, everything. So it's slowly harms your body, not immediately. So it's like a slow poison. So that's why it should be very much in moderation.
The thing is, many people, I mean, many of us, we do have sugar cravings. Like sometimes we cannot ignore it. So,
That's true.
what are some of the effective strategies for the patients or the general public to reduce their sugar intake without feeling deprived or sacrificing taste?
So this is a very fun topic for me because I, being a dietitian myself, but I'm also a human. So I do have a lot of sugar cravings, and people like I would say I have a sweet tooth as well, because usually I crave for something sweet after every meal. So I did a few things to decrease that down, because of course I studied and know the harmful effects and everything. So these tips may help everyone, whoever has sugar cravings or a sweet tooth like me. So firstly, what you can do is, take it very slow. Instead of trying to cut all the sugar out at once, which once I tried to do, which was very difficult for me, but that didn't work. Try to cut out your sugar by just start making small changes. Every little bit of it will help you. Don't try to cut all of the sugar out at once. So just take it slow. Secondly, check labels when you are at a supermarket, when you're buying stuff. Just check, have a quick look at the ingredients list behind. If you see words like syrup or sweetener, it probably means there is added sugar. So make sure that the quantity of syrup or sweetener in that particular item is not more. So if it very much in the beginning in the ingredient list, means that's the highest proportion of ingredient which is there in that food item. Thirdly, go for whole foods. We are lagging behind whole foods. We are going for easy go-to options, and we are not picking whole foods nowadays because we are in such a rush. Pick foods that are close to your natural state as much as possible, like fruits, vegetables, lean meats, and whole grains. If you are craving something sweet, have a fruit or have like some carrots or something instead of munching on biscuits or candies or stuff like that. The whole foods have much less added sugar and more good stuff for your body. Thirdly, when we talk about natural sweeteners, people who have diabetes or who really, really crave sweet but can't have. So, if you want something sweet, try using natural sweeteners again, like honey, jaggery, maple syrup, or even a bit of fruit would do. They taste great and are better for you than processed sugar. But again, all of these in moderation. Uh, these are natural. It doesn't mean you can have uh, unlimited of honey, jaggery, or maple syrup in your meals. It should again be in very, very moderation, and that would be again according to your daily intake, your dietary daily intake. Then drink smart instead of sugary drinks or fruit juices, packaged fruit juices, or soda. Go for water, tea, or infused water with slices of fruit. You can have water with cucumbers, lemons. All these detox your body as well, and also satiate you for a longer period of time. So instead of going for sugary drinks, going for coffees, sugary coffees, which you get, when you go to your office, when you have a go-to coffee, instead of that, try to go for some water. Have a bottle of your infused water with sabza seeds. Those are chia seeds, which are really good for your body and will satiate you for a long time. Decreasing your cravings for something sweet or something snacky or something like that. Then watch your proportions when you enjoy sweets. It is very much okay to enjoy sweets occasionally when there is a festival or so. It is very much okay. Do not try to force yourself to stop or to not have sweet, because that will again just depress you from enjoying the little joys which you have in your life. So again, it is very much okay to enjoy sweets now and then, but try to keep your portions small. You'll get the taste without overdoing it on sugar. Then for your sugar cravings, try to get in more fiber. So foods which have high fiber are vegetables, fruits, beans, whole grains. Again, same, go for whole foods, not for processed foods. Try to have healthy snack items like the nuts, yogurt with fruit, vegetables with hummus on hand. Like, try to carry these from home instead of buying from outside. Try to make more home cooked meals rather than having meals from outside. It would be much better because the amount of oil, the portion of sugar, salt added in your meal, whereas from outside you don't know what is there in what you are actually eating. It is very important to be mindful of what you're consuming. Lastly, listen to your body. Pay attention to when you're truly hungry and when you're just craving something sweet. Being mindful is very important. It does not mean that when you're just working, you want to munch on something, so you get a snack or something. Listen to your body. If it is actually hungry, then you enjoy with a healthy snack um, rather than any other processed food, or rather than any other high salt, high calorie snack. Yeah. So basically, these well combined will definitely help you to control your sugar cravings, and um, hopefully, you will understand how these little things make such a vast difference to your day to day activities as well.
Thank you for these fantastic strategies, Muskan. It's very interesting to see that we can actually make healthier choices without giving up on flavor if we implement these recipes that you have suggested to our audience. Now, coming to our final question of the day, from a clinical perspective, what advice would you give to healthcare professionals on effectively communicating with patients about the health risks of excessive sugar consumption and importance of making healthier choices?
Very interesting question. So this is very important for healthcare professionals to understand that when you're educating a patient about such a topic, because many people really like to eat. Of course, everyone does like to eat. That's why we are actually working. So basically, the healthcare professionals need to understand, when you are telling your patients about such consumption tips or tricks, you need to be a bit more informative. You need to make the patient or the person you're counseling to understand the pros and cons of why it's good and why it's not good. You need to explain how excessive sugar intake can harm the body over time. And most importantly, when any healthcare professional is doing so, we need to use very simple language, because we have studied nutrition, we have studied medicine, but they have not. They might not know the technical terms which you are using. They might not understand those terms. So it's very, very, very important. And I've seen this over the past many years, that patients do not ask questions. They just nod their heads and they are like, yes, we have understood. But it's very important that you, as a healthcare professional, make sure that they understand. Just say it in very simple terms, say it in terms which they would understand. They would actually, if they understand, they would actually use that in their day-to-day life as well. Thirdly, provide alternatives for them. Just do not restrict them to anything. Just say you can have this, but in moderation. If you cannot have this, here is an alternative for you. If you provide alternatives for whatever food group, they would be much happier and more. It would be much easier for them to, rather than restricting, you are giving them an option. So it would be easier for them to take it, rather than if you restrict someone from doing something, it's a human tendency for the person to do it more. So if you give an alternative for them, so that person will do it, but with the healthier alternatives. Then you can encourage moderation. This is very important for us healthcare professionals to tell patients about moderation. Emphasize the importance of moderation when it comes to sugar consumption. Patients don't need to completely eliminate sugar, but should aim to reduce their intake to improve their health or overall well-being. Then discuss all the long-term health effects, as we just did in the first two questions. This helps patient understand that making small changes in your day-to-day life, in your diet, can have a significant impact on your health, on your energy levels, on your moods, and especially for health for your future as well. Then, when healthcare professionals are explaining such a topic, try uh, telling your patients to set realistic goals. Again, as I said, do not try not to tell your patient you have to cut out sugar completely. Just try, just tell your patient that set a goal, set a realistic goal that in a particular week you will have a sweet dish only on one particular day, and you will try to decrease sugar intake every day, not have processed foods, not have chips, candies, etc. every day. Just setting goals will help the patient to achieve that, because goals are there to be achieved. When you have a goal, a human does want to achieve it. So make it easy for the patient, not complicated. That's the basic tip which I would give for all healthcare professionals, and majorly to listen the patient and support the patient. Usually, what a healthcare professional does is he or she will just keep saying that do this, don't do this, do this, don't do this, but they do not listen to what their patient wants to tell them, what they are experiencing. You need to listen to the patient first and then put your professional advice ahead of them. Just first listen to the patient and then provide the advice. So all these points are very, very important for healthcare professionals to understand, that patients are not doctors, are not healthcare professionals, are not dietitians, are not nurses, nothing. They are laymen. They need very simple, realistic points which they can include in their life and achieve whatever they're looking for.
Our expert for the day, Muskan Barmare, I want to extend a heartfelt thank you for your valuable expertise in this often overlooked topic of sugar consumption and its impact on health. Your expertise has definitely shed a light on the crucial aspects that can truly make a difference in people's lives. I hope that our discussion today will raise awareness and inspire positive changes in approach to sugar intake. Thank you so much, and we're looking forward to many more podcasts together on our platform.
Same here. Thank you. Thank you for having me. It was a great chat.
Thank you. And to our listeners, thank you so much for tuning in. Your engagement and interest in these important conversations are what drives us to continue bringing you valuable content. Remember, small changes in our diet can lead to significant improvements in our overall health and well-being. Until next time, stay informed and empowered. Thank you, and until next time, goodbye.